Tonight, folks in South Macon may soon have a permanent medical facility for primary care.
That's after Macon Bibb commissioners approved thousands in American Rescue Plan money for a new first choice primary care office. Anthony Montalto shows us how the new facility can help folks near Houston Avenue get the care they need.
It's difficult. It is very difficult.
Difficult to find good health care if the money's not there. Take it from Jessica Johnson.
A lot of people don't have health insurance.
A couple years ago, she was homeless, but the folks at Daybreak told her about First Choice Primary Care. They offer medical services to everyone, regardless of income.
They help you out, like especially when you don't have health insurance, so it's a major help.
Now Johnson's back on her feet, and First Choice is looking to grow, planning to build a brand new medical facility on Houston Avenue.
The one I go to is all the way downtown Popular.
Soon, though, she plans to go to the Houston Avenue office, just a block from her house. First Choice CEO Catherine McLeod says people like Johnson need better health care options closer to home.
We have been had an office in South Macon for about 6-7 years, but we're in a small rented space and there's a great need for health care in South Macon.
The new office would give them more space, allowing them to hire more physicians. But the biggest advantage this would give them is space to open up a pharmacy.
There are no pharmacies in this part of Macon now. Some of the national chains have moved.
Now, after a unanimous Bibb County Commission vote, the project is $250,000 closer to fruition.
I think it would be much easier for a lot of people around here. It would. It would help out.
And it brings Johnson and her neighbors closer to the medical care they need. In Macon, Anthony Montalto, 13 WMAZ News.
First Choice still needs about another $240,000 to get working on that building. They're using grant money for the bill, trying to save what they have in the bank for another medical center in East Macon.
And potential changes affecting nearly 900,000 Georgians enrolled in their health care plan. We're taking a closer look at a new law that calls for a state-run health care marketplace to replace healthcare.gov. Governor Kemp signed a bill into law today that would replace healthcare.gov as the site Georgians visit to choose their health care plans, including under the Affordable Care Act. Right now, nearly 879,000 people are currently enrolled through healthcare.gov, and the state is currently reevaluating Medicaid memberships. The law is designed to help the state avoid paying billions of dollars per year in fees to use the website.
But experts say Georgia needs to invest in more funding, training, and education for customers before the state site goes live. The online portal still needs federal approval from the Centers for Medicare and Medicaid Services. 18 other states have started their own sites and have been mostly successful.